Hi guys, it's Will Harlow here, the sciatica specialist physiotherapist behind Overcome Sciatica, and today I want to talk about something called a posterior pelvic tilt and how this posture can make your sciatica worse. Let's dive into it. So first of all, we need to start off by defining what a posterior pelvic tilt actually is. So when we talk about a pelvic tilt, we're basically just talking about the normal position that you stand in and what your pelvis is doing at that time. So for some people, the pelvis will be pretty much level. For some people, it will be tipped forward, called an anterior pelvic tilt. And for some people, it will be tipped back, called a posterior pelvic tilt. Now I'm going to cut to another video where I demonstrated the different pelvic tilts, and you can decide which one you've got. Because if you have an anterior or a posterior pelvic tilt, you're going to need to do something about it to get that sciatica better, guys, all right? And this video today, we're going to talk about how to fix the posterior pelvic tilt. Have a look at the video, and if you've got the posterior pelvic tilt that I demonstrate, then you need to follow the exercises in this video in order to get better. In this part of the video, I'm going to demonstrate to you what we call a posterior pelvic tilt. So that is a position where the pelvis has tipped back. Okay, so I'm going to show you my normal posture, and then I'm going to show you a posterior pelvic tilt. We're going to talk about which areas are going to be tight and which areas are going to be long and weak. All right, let's have a look at it. So this is my normal posture. So my pelvis is nice and level, and I can tell that because I will look here and find a bony point at the front, and I'll run my fingers round, and there's a bony point at the back, just below my spine there, okay? And the two, they're pretty level, all right? If I run my finger directly round along my belt line, just underneath it, I'm gonna go from one bony point to the other, all right? And it's pretty much dead ahead. So if you drew a line between this bony point and that bony point, it's gonna go straight through, okay? Now, let me demonstrate a posterior pelvic tilt to you, and you can see if this is something that you might be suffering from. So a posterior pelvic tilt looks like that, okay? I see a lot of people with this posture, all right? It's when your pelvis has tipped underneath and behind. This has come forward. You end up with this almost leaning back look here. Can you see how I'm kind of slumped backwards? My shoulders have come forward as well. You probably can't see in the video, but I'm almost slumped to give myself an upright look. And it actually looks like my legs are in front of my body now. Okay, and obviously I'm doing an exaggerated version of this because naturally for me this doesn't feel right. Okay, I find it difficult to do this. But as you can see here as well, when I'm stood like that, all right, you can see that some areas are probably quite tight and other areas are long. So for example, my glutes, can you see how squeezed in they are, right? They're super tight in this position, okay? They've been shortened, they're pulling down on the pelvis. And that means my back has had to lengthen. So my back is long and my back is weak. My glutes are short and tight, all right? Now the other place that's tight is the front of my tummy here because it's coming in. The other area that's long and weak is the front of my hips. So I'm short and tight here, I'm long and weak here, short and tight here, long and weak here, short and tight here. And now the key area in this posture that's also tight are the hamstrings. Because I've taken my pelvis, I've rotated it back. Now my hamstrings have become tight, and if you're like that for any length of time, they're going to be super tight and they're going to stay that way as well. So I'm tight back here too. Let's have a look at some exercises to relieve this posture and get you feeling a bit better too. So as you can see from that video, when your pelvis is tilting back, it's making certain muscles tight and certain muscles long and weak. Now, this becomes a problem because you end up with an imbalance around the pelvis. And when you've got an imbalance, that makes back pain and sciatica much worse than if you were perfectly balanced. What happens when you've got a posterior pelvic tilt is as you tilt back in your pelvis, you're putting pressure on the front of the spine. If you have a disc bulge, what that's going to do is it's going to push the disc bulge back towards the back of the spine, okay? Now, if your disc bulge is anywhere near a nerve root, the bulge is going to come out, it's going to touch the nerve root, and it's going to give you sciatica down the back of the leg. So you could be walking around with this posterior pelvic tilt, and your sciatica could be raging on and on and on down the leg, giving you lower back pain. And if we fix that posterior tilt and take the pressure off the front of the spine, it will resolve the disc bulge, allow everything to heal, and can accelerate your recovery even further. This video is going to teach you how to do that, okay? And let's have a look at the strategies that I've got for you now. Welcome back, guys. Today we're going to talk about how we fix that posterior pelvic tilt. I'm going to show you two exercises. They're both stretches. You may have seen them before, and if you have seen them before but you haven't done them yet, it's extremely important that if you've got a posterior pelvic tilt, you put these into action. Let's have a look at them. One of them is going to stretch the hamstrings, and I know I've said before, if we have sciatica, we don't stretch the hamstrings. That's why I only want you to do the hamstring stretch on the good side, all right? It's very important we don't stretch the side with the sciatica until the sciatica is gone. I'm going to show you this hamstring stretch. We're only going to do it on the good side, and then I'll show you the other stretch in a second. Let's have a look at it now. So for the hamstring stretch, you're going to start off in this position here where you're on your back. You take the pressure off the lumbar spine by bending your knees so your hips are slightly up as well, like this. You should be nice and relaxed in this position. Now, for the purpose of this exercise, we're going to pretend that the sciatica I've got is in my right leg, which is on this side, and this side is pain-free, okay? If you have sciatica in both legs, this one's not for you, so skip to the next exercise and do that instead. However, if you've just got sciatica in one leg, I want you to try it on the opposite leg, okay? So this is what we're going to do. So you're going to lift, first of all, your good leg like this, and you're going to tuck your hands underneath like this, okay? Second step, you're just going to extend the good side and keep the toes pointed towards the ceiling, and then come back down. So you're going to go up, far as you can. Don't let this leg come down, all right? You've got your hands there to stop that from happening. Keep it there, and then down. So you're going to hold it for about 10 seconds total. So up, hold for 10, and down, good. And again, up, hold for 10, and down. Now there's something else I want you to do while you're doing this, okay? You're going to take your pelvis and you're not going to let it roll back, okay? You're going to keep it forward if you can. So pelvis comes forward, leg comes up, your pelvis will want to roll back, don't let it. Extend and down, okay? And you'll probably feel that once you switch that pelvis position so it's rolled forward, it's actually harder to do the first part of the exercise. So up, hold, and down. If at any time during this your sciatica is worsening, just stop it, okay? Stop the set there, come back to it later in the day. If it feels good, just keep going, probably for about 2 minutes at a time. That sounds good to me. 2 minutes is good. 2 minutes times about 3 per day is ideal. Now for the second exercise, guys, we're going to stretch the other area that's extremely tight in people with a posterior pelvic tilt, and that is the gluteals. They're your buttock muscles, okay? Right at the back, the big muscles that you sit on, those are the ones that are extremely tight in people with this problem. So what we're going to do is we're going to do it from a sitting position. I'm going to demonstrate it to you now, and I want you to try it at home. I want you to just first of all try it again on the good side. We're going to leave the bad side alone if possible. For this one, if you do have pain in both sides, you can give it a try, but only keep stretching the side that feels more comfortable than the other side. Now, if either of them give you above, say, a 5 out of 10 pain when you stretch them, I want you to stop using the exercises in this video and try some different ones instead. Let's have a look at this one, and you can practice along at home. So you're going to start from a sitting position, okay? So this is a normal sitting position for me, but if I had a posterior pelvic tilt, which is this, you might be more likely to slouch like this. You might naturally sit forward. So your pelvis is rotated back. You might find that this is elongated here, and you've probably got a little bit more of a pouch of belly fat there if you're posteriorly rotated, just because you're compressing everything. So if you sat normally, you're up right like this. If you sat with a posterior tilt, you're down like this, you're a bit slouched, okay? The first thing I want you to do is I just want you to try actively to correct that. So the way we would do that is you put your hands on your pelvis again, like we did earlier in the video, and you just roll it forward and just try, stick your tummy out and then come back to normal. So you'll want to make a gap at the back, as if you're just rounding your back slightly, okay? And then come back. So what I want you to do is just from a sitting position, just practice rolling. Okay, so you're going to roll forward and roll back. Now you probably won't be able to roll as far as I can because my pelvic movement isn't too bad, but if you've been stuck in a posterior tilt for a long time, it's going to be much more difficult for you to do that movement, okay? So even if you can just get to there, not a problem, just practice that for a couple of minutes, okay? Now for some people that might be enough to start to get a change, but I want to show you how to accelerate that even further with a stretch for the gluteal muscles too. So you're going to start off in your normal sitting position, and again we're going to stretch the good leg first. So we're going to say that my left leg is my good leg, this is the one with sciatica, so this one stays still. What I want you to do first of all is just pick up your left leg and just pop it there over the painful leg. So this is the non-painful leg, this is the painful leg. Now, you'll find that you'll naturally want to sink back a bit when you do this. I want you to assume, first of all, the most comfortable position, then pop your hands just on your pelvis like this. And now I want you to push this knee actively towards the floor. And as you do that, I want you to practice that forward roll that we did before. And you're just going to hold when you feel a stretch, and then you're going to relax both. So this knee comes up again, and you can relax back to your normal position. Then I want you to push it down again, and then roll forwards like we practiced. Even if you can't get as far forward as me, it doesn't matter, just the action of rolling it forward will stretch it more. And then relax. Okay, and you're going to do 10 repetitions of that in a row before you stop, and I want you to do that every few hours for the first few days, and then at least 3 times a day thereafter, until you feel like you start to see some changes in your pelvic positioning when you're standing and when you're walking around, and you'll probably start to notice an improvement in your sciatica and back pain too. So there we have it, guys. That's how you fix a posterior pelvic tilt when you have sciatica. Give those 2 exercises a try. Like I said before, they need to be done consistently for a number of weeks before you notice a real significant benefit. But the reward is well worth the effort if it takes the pressure off your spine and helps your sciatica get better quicker. The exercises shouldn't be uncomfortable, so if they are, reach out to me and I can give you some advice on what to do next, or try one of the other videos. Thanks so much for watching. If you're on YouTube right now, make sure you subscribe to the channel so you get my anti-sciatica videos as soon as they come out. And if you're on Facebook, it would mean the world to me if you could share this with a friend or some family members who might be suffering from this condition as well, so we can help them get better quicker. If you'd like some more information on getting better, as well as my most comprehensive 8-week roadmap for getting there, then the Total Recovery Program for sciatica could be exactly what you've been searching for. At the time of recording, it's not available right now. It's still in its testing stage. But if you're watching this in the future, it could be available for you to purchase today. Regardless, there should be a link below this video where you can find out more about the Total Recovery Program, as well as register your interest for when it comes out. Thanks again for watching, and I look forward to seeing you on the next video.